Good morning. The medication that I am prescribing today is Lasix, also known as the generic name Furosemide. Lasix is a loop diuretic, also known as a water pill, that may be easier to understand. So what that means is that this medication is used to help eliminate extra water within our body, and it can also help lower our blood pressure. If the body carries too much water, it can cause problems within the body, such as making our lower extremities, such as our legs, swell up with extra water, kind of like how a balloon fills up with air. If your body contains too much water, it can make it hard for other organs to function, such as your heart, making it more difficult to beat. Within the body, there are electrolytes called sodium, also known as baby salt, and potassium and chloride. Lasix works by stopping the absorption of sodium, potassium, and chloride within our kidneys. We have two of those in our body. Lasix will instead increase the amount of sodium, also known as salt, that is excreted in our urine, which causes our bodies to get rid of the extra water. Therefore, it will lower our blood pressure if our blood pressure is elevated, and or even if it's normal, it can potentially still lower your blood pressure. And it can also make the swelling in our lower extremities go down. So that inflated balloon that I had previously referenced, it can help make the balloon go back to a normal size or completely deflated, so that you have a better picture of what the water pill does within our bodies if we have any type of edema or swelling. This medication can go into effect once taken within 2 hours, and it may last up to 8 hours within our bodies. During this time, you will experience increased urination because the body is getting rid of that extra salt or sodium and the extra water. This medication is processed mainly by our kidneys, and a small amount is processed by our liver, and most of it is excreted within our urine. Sodium or salt, potassium, and chloride can hurt how too much of it can hurt how our muscles functions in general, especially our heart. And too less of it can also do have the same effect. So that's why it's important, if you're feeling any chest pain or chest tightness, that you notify a healthcare provider while you're taking this medication. And if you notice also that your urination has decreased, where you don't urinate as often, you also want to notify a healthcare provider while you're taking this medication. Lasix is prescribed in children, basically based off of their weight, usually, because it is a very strong diuretic. And in the elderly, it is important to monitor the liver, kidney, and heart function due to possible age-related conditions. So as we age, our bodies usually sometimes can get a little weaker or be more susceptible to other illnesses such as hypertension and different, or diabetes, for example. So it's important that your healthcare provider is monitoring these other conditions in regards to taking this medication, because it can also impact that as well. Patients also on LACEs may need to take a potassium supplement or increase potassium in their diet, such as eating more bananas as well. So that's the medication that's being prescribed for you. Please let me know if you have any additional questions.